patient really changes the way I approach my practice of medicine now, just because I'm much more attuned to what it feels like to be on the other side. Just the little gestures or words of encouragement that come from everyone from the nurses down to the anesthesiologists to the surgeons to the person that brings the food for dinner really means so much to the patients and really meant a lot to me. I mean, I just didn't realize how the little things when you're a patient could affect you so much and just really brighten your day, and just know that somebody's taking that little extra effort to make your day a little bit easier.
Just today, for example, the reason that I'm here later in the day rather than earlier in the day is that one of the nurses in the hospital asked specifically for me to provide her anesthetic for a procedure. I've worked with surgeons that I've had a long relationship in working with those surgeons. Most particularly, I can think of some of the neurosurgeons I've worked with, some of the cardiothoracic surgeons I work with, and as a result of that relationship and their patient population who not infrequently returns for multiple surgeries, you do get to know the patients, and the patients get to know you. And even though we meet each other for a thin slice in time of their life, they remember that experience very intensely, and they will remember you as an anesthesiologist, and they will remember to ask for you as an anesthesiologist, because they do bond with their anesthesiologist when they have an experience that makes them feel safe and cared for.
I remember one time, as my first year in practice, it's been about 20 years, I was on call for Thanksgiving, and a patient, an adult patient who worked not too far from our hospital, came in acute respiratory distress, and he had developed an infection called acute epiglottitis, where his airway was just rapidly swelling up and he couldn't breathe. And you typically see it in little kids. I had never seen it in an adult, and I'd only seen it once before, even in my training. And so on this particular day, there's skeleton crew around, it's just a handful of us there. We took this guy into the OR and we breathed him down so slowly and carefully, and we got him to the point where we could slip a tiny little tube into his airway before it completely closed off. And it was so nerve-wracking, but when it was all over, I thought, this is what I'm here for. This is why I do what I do. I just thought, I saved this guy's life, and it was great. It was great. So, it's moments like that that you live for.
Another very rewarding thing is actually when we take care of women having babies, and a lot of times they're just in their regular routine labor, but something will happen, the baby will be having problems, and we'll have to go back to an emergency C-section. And then you have a patient who's wide awake, who's scared to death, has an epidural, which is her anesthetic, but we can't give her anything else until the baby comes out. But once the baby does and the mom sees the child, that's a very rewarding experience.
I have a lot of stories that relate to the way patients perceive their experiences. And it's always gratifying when you receive a card or a letter, somebody actually taking the moment to write you. Especially in today's world, people don't write that often. But it's always touching when you get a letter from a patient thanking you for what you've done for them. I've even gotten letters like that from families when we've undertaken risky surgery that maybe didn't turn out right. And it's always, you realize that the amount of trust they put in you. You realize how they've confided in you, they've trusted you, and they know that you're going to do the right thing. And that's probably one of the most important things that we derive as doctors.